And we are back, and we're jumping right into our first conversation. Of course, we have our COVID-19 update for you, and here to discuss the public health management in the wake of the COVID-19 worldwide pandemic is Dr. Ramon Figueroa, who is a former CEO in the Ministry of Health. Good morning. Thanks for joining us.
Well, good morning, and thanks for inviting me. Just stating that I'm also now the Executive Director for the National Health Insurance. So
That's right.
That's right.
Yeah.
I
Which
won't
is, how
speak
you
on
were
behalf of
allow-
the-
which is how you were allowed to be here this morning, so people can be clear.
Yes.
But Dr. Figueroa, it is an absolutely interesting time, and I think while we are very focused on what's immediately in front of us, there are a lot of lessons to be learned from what has happened in the past. We faced epidemics, and there have been pandemics before as well. What stands out as the most critical fact about COVID-19?
Well, let me start off probably by doing a quick revision of how we got where we are at this point in time. I think everybody already knows that December 31st was the first index case diagnosed. But probably the infection was already there a month or 2 months before.
That's right.
Everybody's still looking at how did it cross over from the animal kingdom to the humans.
Yeah.
We're still animals as well. And then 1 month afterwards, January, the WHO already declared this disease a public health emergency of international concern. And then in March 11, WHO declaring this pandemic, meaning that basically it had spread to all regions of the world. In the course of 3 months, I think if you sit down and look at it, in the course of 3 months, we are now reaching a level where we have almost over 1 million infected, and probably more, because that's 1 million that have been diagnosed.
Yeah.
You calculate another 25 to 30% or more out there infected. So you're looking at a huge number of people that are infected, with almost 50,000 deaths already in the world. So in a very short period of time, we've had this infection that has traversed the whole globe and has caused a major tidal wave, as I call it, to our health systems across the world. And it doesn't matter whether you are a high-income country or a low-income country, the huge surge and devastation it's causing in the healthcare system is incredible.
Yeah.
Then you look at historically though, 1918, for example, the Spanish flu, that ended up with about 20 to 30, 40 million, there's estimates of deaths.
And that was an influenza virus.
That was an influenza virus. Then you had the SARS, then you had the swine flu, which was also responsible for 100 to 400,000 deaths. Ebola. Anyway, if you look at and more they're getting frequent, more frequent. It should have sent us a message. And I think if the other day I was listening to Bill Gates, and he's been telling us for years. And not only him, but there's been others who have been telling us for years, you need to prepare. That's the next challenge for healthcare systems. And I think hopefully with this, it will shake us up and alert us and make the necessary health system changes that have to be made from a national perspective and from a regional perspective, because I think regionally we also have a big role to play in terms of procurement of supplies. If we start looking at what are some of the challenges in other areas in terms of procurement, on an individual basis, a country is challenged to be able to source things. From a regional perspective, I think there's strength in numbers, and it would be so much easier, but we have to prepare for these things.
Now, a pandemic of this size feels like such an anomaly. You know, while we've been seeing some of the other outbreaks and epidemics and eventual pandemics, this is beyond what anyone could have imagined. But there were other countries in the world that had been preparing, at least in terms of planning, to face pandemics. Is that the case?
There's some countries, I guess, some countries in Europe have had started preparing. labs had started preparing. I think that's one of the reasons it was so quick in terms of determining the genomic, the diagnosis of the virus and the genomic composition of the virus. But I think there was still a lot more to be done. Look, a lot of other countries, there's a couple of things that influence what's happening. For example, some of the countries are very quick, decisive in making decisions. Extensive planning before it eventually became a huge. Other countries didn't take it that seriously, and so they've been and they're the ones that are overwhelmed at this point in time. So there's a lot of critical factors that determine. But I think one of the principal characteristics of this infection is the virus itself. I remember in school when they were one of our microbiology teachers was telling us what's the perfect infective agent. The perfect infective agent is one that infects you, doesn't kill you immediately, has a long incubation period, acts as a guerrilla, sort of a guerrilla warfare, has a lot of asymptomatic carriers that spread the virus, and still causes havoc in the human population. This one seems to have all those characteristics.
Fit the
criteria.
Yeah.
So while a lot of it, in terms of being a coronavirus like SARS coronavirus 1, it has but it has some additional characteristics that makes it so devastating at this point in time.
And so in terms of our preparation for it, what are some of the specific things that are important that we get right, or we should have gotten right from in preparing for this or the spread of the virus to Belize?
Well, early planning, that's one of the things, but you could look at it in terms of sort of simplistic manner. It's basically public health interventions, the things that we've been talking about for ages.
Yeah.
Infection prevention and control from an individual perspective, hand washing, stop touching your face, basic things that I remember I grew up with. I think we've lost it over time.
Yeah.
And on a collective infection prevention and control in a collective manner as well. So now you're talking with this particular disease, social distancing, isolation, individual responsibilities. So the responsibility is really on the population. Number one, to take it seriously. Number two, to listen to the guidelines as being and the information being given by the Ministry of Health and the government, and be responsible. The magnitude of the disease and the impact of the disease is totally dependent on the overall population reaction.
Yeah.
There's no treatment.
Yeah.
There's no vaccine. So the healthcare system is, all they can do is prepare for either a massive onslaught or a gradual onslaught.
And that perhaps, I think, is the part of the conversation we don't look at very often. The biggest challenge in this pandemic is that it forces us to recognize that we have to change our behaviors, which is one of the most difficult things to do. We are relying on everybody. It takes everybody to follow through on the procedures, to wash their hands, to keep their social distance, to report symptoms, all of these things. There's an individual responsibility, and that's how we can overcome this. And behavior change is hard.
That's one of the hardest things to do. I mean, we've always talked about behavior change. We spoke about NCDs. Yeah. We know what are the factors, but at the end of the day, it's your responsibility and my responsibility to make a change. It's been difficult to make that change, and now you want to make a sudden change and a quick change. That is
drastic.
And drastic change, and that's why I think the measures taken by government are so important.
Yeah.
Because I think you need to have somebody police and tell you have to do it.
Yes.
I've been telling you to do it. You're not doing it. I need to enforce that, and I think that's what is going to hopefully. Because the other thing is that we are not going to stop this epidemic.
Yes.
We need to be very cognizant of the fact that no country has been able to stop. Remember circulating on Facebook, there was this graph that says you flatten the curve.
Flatten the curve, yeah.
That there's a couple of messages in there. One is that you're not going to stop the wave. What you need to do is modulate that epidemic. to a level that the health services can manage. And you can do that by social distancing and that sort of. But I don't think we'll be able to stop that epidemic unless we discover a vaccine very soon. And all the information we have is that the earliest it's going to be is probably a year, and that I think it's probably going to be more than that. And
It's
by the time we
for it
access
to be developed,
developed.
and for us to be able to get it in Belize or
Correct.
in this region
Correct.
is another
It's
length
another,
of time.
another, yeah. And the other thing that's important, I think people need to realize that with this epidemic is that the whole world is susceptible. The whole world is vulnerable. You have no previous immunity to this virus, and which is why it's like a wildfire. You light a match in a dry area, it can explode. And that's basically the comparison one needs to understand, that everybody is susceptible. And this you're going to get it eventually.
Yeah.
And how you end up is also dependent on, obviously, on your immune status and,
Yeah.
and so.
Can you clarify? I feel that sometimes we see this measure, the state of emergency, which is a critical one to keep us from having a large spike in number of cases. But I also feel that sometimes the message that people have interpreted is that we'll come out of this COVID-19 free. How practical is that thought?
And that's, I think, what I wanted, the point I wanted to make in terms that we can't stop it. Because one of my concerns, in the planning process, I feel that this is going to give us maybe opportune time to continue the preparatory phase.
Okay.
All right? But eventually, we're going to have to relax, or I don't think we can be on a lockdown for 6 months, a year. Eventually, and all the countries around us are going through that infection process.
Yes.
I was listening to somebody the other day saying that the expectation is that over the next 2 to 3 years, at least 80% of the population will be affected by the virus. So it's telling us that eventually we are going to get it. Again, the message is we need to modulate that infection rate so that at the end of the day we don't get overwhelmed, and that we can treat the patients at the hospital level in a proper manner. Because if you get a wave of people coming in, eventually the quality of the service you're providing gets affected.
And we already know we have limited capacity in terms of healthcare.
Absolutely.
We had Dr. Cuevas here who said, stop worrying about ventilators, just stay home, because we're expecting the system to kind of catch up to a pace that we aren't capable of right now.
Yeah, but I still think that we need to pay attention to the ventilator. You see, the lines of intervention, even though I said the control measures are really preventive infection control measures, we have to prepare as well in terms of protecting the health system itself. So we need to ensure that we have the capacity. We need to get the ventilators, and right now there's a huge challenge in terms of sourcing ventilators because the US is sucking up everything that they can get. And we need to have proper PPEs. You know, there's also this debate recently, and I tend to agree with it, that maybe we should start giving masks out to everybody. The concern is that if you do that, that they will take
Not
away
enough.
from. But what you want,
or that people won't use it properly and put themselves more at risk.
well, I don't think there's any
I'll give you
scientific
an
evidence
example.
that
Yesterday
says
we carried a story in the news. People had the masks
Yes.
under their face
Yes.
and they were hugging people.
yes, but I think that can be resolved by educating and but that is one of the, at least it's being highlighted as one of the interventions that has saved, for example, Hong Kong, Taiwan, and a lot of the Asian countries. They now use masks.
They
as
have a
part-
practice because
have
of
a practice.
pollution. But I want to ask you about that, because I think it's really interesting to see how the information changes as time goes by. You stated it very clearly in the beginning, and I think it's one we have to keep on communicating. We're only 3 months in. The information is kind of coming out as we go along. We're learning from countries as they're in the thick of their crisis and as the crisis starts to wane a bit. And so that's how the information gets to us. When we get mixed messages like, don't use a mask, maybe use a mask, yes, use a mask, it's hard for people to have confidence in the information that they receive.
No, absolutely, but that's part of also a problem with having social media. Social media to me has two edges to it. I think the sharper edge is on the negative for me.
Yeah.
Because too much wrong information is being sent out,
Yeah.
and it's confusing, and people tend to hold on to things that make them feel better.
Yes.
Yeah, you've seen all these things, articles about what works and what treatment they use and what vitamins they can take and about drinking hot water that melts the virus. I mean, the amount of information, and that's also one of the things that is important in terms of trying to avoid chaos and confusion in society. There needs to be a trust in the institutions giving out the information, but trust comes with open communication. We need to be very open with the public. I think the decisive action taken by government and the opposition is an excellent message sending out. This is a time for unity. This is a time that we need to pool our resources together and work together. That's a great message. I think it gives people a little bit more sense of security, that somebody's in charge, that somebody's making decisions, quick decisions. But you're right. I mean, we have to be very careful in sending mixed messages. Today we say something, tomorrow we change. Even though this is a work in progress in terms, because we don't know anything really about the virus itself, and what works and what doesn't work. You know, I mean, CDC's one day they said, all right, don't use face masks. Now they're considering using face masks. They've also advocated for using bandanas with healthcare workers. The point is that I think, and the message I think we need to take is that we need to be innovative sometimes in the way we approach. If we don't have, let's say for example, we don't have N95 masks, the second option is another surgical mask, and the third option is bandana. That's what I'm reading from CDC. You get overwhelmed. You can't just say, all right, I give up. You have to come up with some innovative ways of dealing with the issue. One of the advantages I think we have as a country here is that most of the masks and stuff we procure from outside. Government is the largest purchaser of medical equipment. They can purchase all the N95. I'll take over that and then distribute it to my personnel. But we need to plan. We need to ahead of time. We need to prepare ahead of time. And for us, we require a lot more time because we have to compete with other entities in purchasing these things.
So what I hear from you is that the state of emergency, while it is important to reduce the spread of the virus, because the virus spreads rapidly, reduce the spread of the virus, but at the same time is a critical phase for the planners, that they try to get everything in gear for the cases that will eventually come.
That is correct. I think that's one of the things that we need to consider, not put down our guard and saying, okay, this state of emergency is going to resolve the problem. The state of emergency is going to give us a period of time in which we need to start preparing and ensuring that we have all the training of our personnel. Because remember, the other thing we say, we need to get ventilators. Yeah, but we need to train people on how to use ventilators. We need to have the proper supplies at the hospital for intubation. We need to have the proper guidelines in terms of management of cases. We need to train our people and prepare our people. We need to talk. Look, there's a great fear out there, even in our frontline workers. Nurses have expressed they're in panic. With news about the nurses and medical personnel dying from this disease. There's an inherent fear in our, and we need, as the managers and administrators, we need to reach out to them and talk to them and reassure them that we got their back. We will take care of them. We will provide them with all the resources for them to be as protected as they can be, and ensure also that, because that's the other thing, they're so overwhelmed sometimes. If they get this massive they're so overwhelmed that they stressed, overworked, and that puts them also at a high risk because you stress, overwork, poor nutrition, your
Lowered
immune system goes down, and then you're at the front line, you become a high risk. And there are some people, frontline people, who are also diabetics.
Mhm.
So we need to do that proper human resource planning as well,
Yeah.
and not and remember that we have all the regions and the districts as well. So it's not only Belize City. We need to reach out to all the other areas,
Mhm.
and I think there probably we have not been as effective
Yeah.
as we need to be, because there's still a lot of fear outside.
Yeah.
I think the statement made by PM that, listen, we are going to provide you
Yeah.
with enough financing for if you need babysitters, for a place to where you can isolate, where you can change. But I think at the local level there needs to be also that reassurance, and I still feel that we're lacking that. So that's the communication internally with our frontline soldiers, so
Yeah.
to speak.
So
There's
that-
also that communication with the public,
Uh-huh.
Yeah.
which is also a major challenge.
Yeah.
And I was gonna also ask, in terms of planning and management, looking forward and after the initial 30-day state of emergency, maybe you could describe what you would consider to be the best case scenario in terms of our management of, let's say if we do the preventative measures and we keep flatten the curve, or we don't have much of a curve yet,
Okay.
but so yeah, what would be the best case scenario in your view, and how we couldn't possibly manage this because we going back to you say we can't prevent it from coming, we can't prevent it from spreading completely, but yeah, what would you think be the best case scenario?
Well, hopefully, if we're able to explain to the population and convince and continue the education process during this period, and where people start changing more their habits,
Yeah.
I think the infection rate and dissemination will be less
Yes.
marked. So eventually, you will be able to, as you get the cases, you will be able to manage that. Hopefully, the hospitals are better prepared. You will get maybe a couple of cases that require they can be managed properly, but you have the equipment that they can be managed and not cause internal hospital infection as well, because you don't want to convert hospitals as a source of infection afterwards. So that I see, you will have cases, but we will be better prepared. The number of cases should be less. The spread of infection hopefully would be less if we continue, but we need to, this month, we need to wrap up the messaging,
Yeah.
the outreach to population. Because if we say just isolation and quarantine, we don't continue to message people and try to convince
About
people
washing your hands,
about washing their
not
hands,
touching
about
your
being
face,
right,
proper cough etiquette.
correct.
Yeah.
That at the end of the day, we'll be right where we started
Yeah.
at the beginning. So those are things that I think we need to keep in mind.
And I think that part of that messaging is explaining to people just how sneaky and evil this virus is. And I wanted to get your expertise on this. So it is more contagious than a flu. That's what the data seems to be saying right now. It is more severe for those who develop the symptoms. But also what seems to be the recent data, and I think it prompted the CDC now considering having people wear masks, is that they have now gotten sufficient data to say that a large number of people are walking around perfectly fine with COVID-19. Like, I could have gotten it last week and I could be here every single day with not a single symptom and be passing it on to everyone.
That is correct. I mean, I think they've even thrown figures of 25%
Yes.
of the population walking around asymptomatic,
Mm-hmm.
but still what they call them super spreaders.
Yeah.
They're spreading the virus. So every individual needs to be able to understand that and not only rely on whether they have symptoms or not,
Yeah.
to observe the infection control measures.
Mm-hmm.
It has to be part, we said it's going to change life.
Yeah.
We need to incorporate some of these new practices in our daily lives. We spoke, I don't like that issue that we can't hug anymore, but it, for a while it has to be some of the things that that we incorporate.
Yeah.
You know, and I think the other thing that I think we need to do right now, which I forget, and I think is important, is that we need to reach out to the private sector as well. I feel that sometimes, and I'll talk my time when I was, we tend to plan and think that health is only the Ministry of Health. We have a lot of other stakeholders out there that are waiting and willing to help. For example, with the National Health Insurance that we have contracts with clinics, they're waiting, they're willing to help, they're willing to assist. We just need to reach out.
Yeah.
And so we've been able to do that, and I think they're providing quite a significant support to the central region. The same thing with other regions. So, but we need to reach out.
Yeah.
You know,
So
that's
let's
important.
let's talk about that a bit. Just how the NHI system is working in parallel with the Ministry of Health system, because you have clinics. We know in Belize City, especially, and you do kind of primary health. So it's one of the frontline spaces that we have.
I'm correct. It's not parallel.
Well, I'm asking, is it parallel?
No, it is part of the health system, and that's, I think, one of the misconceptions that we've had over time. It creates a bit of a problem.
Yes.
That we think NHI is separate from, it's part of the health system. It's part of the network it's a primary care network that exists there to help the Ministry of Health. So we just recently sent out, because some of the people think also that, oh, I belong to NHI, I don't have to work with. No, this is a type of national emergency. You are now subjugated to the rules and guidelines of the Ministry of Health, and you need to be part of the resources of the Ministry of Health. So what we've tried to do, and in Belize City we have private providers. As I said, we've reached out to them, we've sat down.
So you have the Mercy Clinic over here that works with elderly from the entire district.
Yes, it involves from the entire, we have, I think, people even from outside of the district, but
and
it
you
is
have how many
specialized.
how many in Belize City?
5 clinics.
Okay, tell us all of them that are
Belize
NHI.
Medical Associates, Belize Healthcare Partners, BFLA, Matron Roberts, and Mercy Clinic.
Okay.
But Mercy is, we've tried to pay special attention to Mercy because they're a high-risk population.
Yes.
So we're setting up, trying to avoid people coming in. We're reaching out to try to give out all their chronic medication, because most of them have chronic medications, a 2-month supply, so that they don't have to come in. And the same thing the other clinics are doing now. So we've highlighted who are those who are hypertensive and diabetic. We've tried to use technology through Zoom to reach out to them, explain the importance of them being isolated. If anybody in their household has a cough and cold, you are high risk. You need to find a way. What are the criteria for isolation? Send and get your medication. Get a 2-month supply, so you don't have to come to the clinic. And we've helped some of the clinics also establish guidelines how you deal with the outpatient. So now we're separating those with respiratory infections versus all the others, and we've worked together with all the clinics, and all the clinics are part of that. They've also coordinated with the regional management of Central Region to also offer. They're willing to come in and take on the excess load as they converted Cleopatra White to a respiratory center.
Yes.
They're willing to take the excess load of all the other cases, because we can't forget that there are still other needs in society.
Absolutely.
We can't just close down and say, you know what, we only have to deal with COVID-19. There's other people who have needs.
So yesterday, Central Health Region sent out a release talking about new procedures, and it's talking about what to do when you have flu-like symptoms. So that's critical information as well. So what they're telling people is, stay home, still stay home.
Stay home.
Even with flu-like symptoms, and call first.
Right. And so that information has been shared with all the clinics.
Yeah.
We had a Zoom session yesterday to talk to Doctora to see what are the updated guidelines so that everybody has it. And there's been also telephone numbers circulated for each clinic, so that if you belong to that particular clinic, you can call that clinic. And then they'll do an online screening and send you to the proper referral center. So we're finally
Is that so that a person who may potentially have COVID not go to a clinic and expose others who may be there for prenatal checkups or whatever other issue they're dealing with?
That is the whole idea.
Yeah.
And but we've also separated at the clinic where you have anybody else who comes for any other
Okay.
consultation is seen by a separate staff in a separate area. Those who come for cough and cold is in a separate line, a separate staff with all the proper
Okay.
procedures. So we've standardized that and circulated across
Okay.
so that everybody has that. Also remember that one of the things that we need to consider when we say somebody has suspected and they need to come in and swab, we have to consider the whole process of risk as a person moves around, because not everybody have a vehicle,
Mm-hmm.
and so we have to be very
They may
careful.
come on a bus or
They
in a
come-
taxi.
Correct, correct. So those are things that are part of the planning process that I think we need to pay attention to. One of the things that we've done with through the National Health Insurance is we call them the COVID packs. So no, it includes Tylenol, cough medicine, and antihistamine. Put them in packs for a week
Okay.
treatment, so that people have cough and cold and you could stay home. Send somebody to pick the package. You don't have to come to the health center. We'll get it to you,
Mhm.
so that you treat yourself at home. You have the medication. You don't have to come to the facility.
Okay.
The idea is you have any right now. You treat anybody who have cough and cold as a potential.
Mm-hmm.
Stay home.
Mm-hmm.
Stay home unless you have a severe case or medical case. Then call and get some guidelines as to where you can go.
So when you're filtering out these cases, how do you decide who's going to be tested?
Well, that's a Minister of Health guideline.
Mm-hmm.
I believe that up to yesterday, we had a discussion yesterday on that. If you're symptomatic and you meet the case definition,
Mm-hmm.
you've traveled abroad coming from a place where there has community transmission, and you're symptomatic.
Mm-hmm.
That's probably one of the primary criteria for you to be tested. But we're
So we're
discussing
still relying on a travel history
yes, and contact with anybody
or
who
contact with someone who's
with somebody
traveled as
who's
well.
traveled.
Okay.
Yeah.
Yeah.
So
Do you feel that we're testing enough?
No, I don't think so. But that's not because we don't want to test. I think. Remember, we're limited also by the number of tests that we can, so we have to be very judicious in the way
Yeah.
we do testing. I wish we could do more testing. I think everybody agrees that we should do more testing, but we don't have all the number. So we need to be very judicious and use it.
So let me ask you about that. So, we hear 2,000, 3,000 tests that will or most likely will come. Sometimes when we hear numbers like that, we think that's a lot. That's enough to just do mass testing to anyone who has flu-like symptoms.
I don't think.
How do you, I mean, is that an accurate way of thinking?
I don't think that's still enough. I think what it will do is it will allow us to do a bit more, because there's guidelines and criteria. What is priority number 1, number 2, number 3,
Yeah.
and so you move down the priority list depending on the number of resources and testing kits that you have.
Yeah.
So
But your whole issue is that it has to be sustainable, because it's not just a month that we're looking
Right,
at. We're
right.
looking at the next few months.
Correct.
That we
Correct.
have to have tests
correct.
available.
So we need to plan how we're going to use this supply
Yeah.
over time.
It's like when you have a tight budget and you have to pinch
Correct.
pennies until you get there.
Correct. Correct.
In,
Correct.
in being able to help the public, everybody's at home this morning. It's the beginning of a very strange experience for all of us. How can you help us understand what we can expect from what we've seen in other parts of the world, from the actions that have been taken? What can you say to people about what type of expectations to have?
I probably would say, look, as we were saying, we need to still hammer out the information about hygiene, infection prevention and control, and make it clear to people, that what's happening, what you're seeing out because now you're going to stay home and watch TV and you watch all the news from what you're seeing out there.
Yeah.
Can happen here if we don't take more precautions and start adopting some of these preventive measures. That doesn't mean that at the end of this period we will not have additional cases, but we can reduce the impact and avoid what's happening in some of these countries, what you're seeing on TV in some of the emergency rooms and intensive care units. We can avoid that by us being responsible in the way we, and this month is a critical, I think we need to hammer, for me, education and
Why do they keep
information
saying
is
that?
really
Why is
key.
this month so critical?
Because we have a right now we literally frozen the country to say, all right, we're not going to move around and spread the infection, hopefully. So this is a point where we expect that the transmission and the infection spread is going to be either stopped or we hopefully we don't have local transmission, and so we prevent anybody from coming in and at this point in time. So that gives us a space of time. After that, you will go back to moving around. And if we don't modify our behavior at that point in time, we go back to where we were before again, where we have that massive, we can have that massive infection again. So I think we could use this as an opportunity. Tell them, you see what you see on TV? You're just as responsible to prevent that, but you need to adopt hand washing, stop this, they circulate around the place, like as I heard the attorney said, stop the bafu around the place. Right? But those things, I think, even afterwards, we will have to look at mass groupings as something that we would probably not want to do even after this month period, and probably go slowly into try to go back to normal in a gradual phase. That's what I would think.
Wow. And looking at lessons learned. So China is the furthest ahead because they started. I know now there are recent concerns about how much they reported cases, but we now see them looking at reinforcing restrictions as to who come into the country, that they've had people import cases again. What does that say to us for our future?
Well, for one, I think, for example, one of the things that's important for us to learn is that we need to ensure that our health systems are up to par. We need to invest more in our health systems, in the capacity to react, in the capacity to plan. I think one of our advantages in Belize is that we have quite a strong primary care system. It's important. We need to invest more. There's actually, now that you say it, in 2006 or somewhere thereabouts, 3 or 7, there was a joint external evaluation of our international health regulation capacity in country. That's important because it gives you a framework of what sort of investments need to be made in the country in terms of being prepared for actually for epidemics. And there's a lot of areas that we failed.
Yeah.
We need to focus back on that and see how we can strengthen that capacity.
Yeah.
Invest in more in public health, capacity, lab capacity, surveillance capacity. From a regional perspective, I was saying I think we need to start looking at better surveillance systems, procurement, quick procurement. If there's one thing that this taught us is that we should have the capacity in the region to either convert private sector into manufacturing.
Yeah.
So those are things that we probably need to look at and learn, and do a lot more. We need to do a lot more. Pay attention to climate and climate. This is part of the climate change, and as well, we're encroaching into the animal kingdom. The population is expanding. More interaction between humans and animals, and that is part of the reason we're having these crossover infections, and it's not going to stop. So those are things that we have to look at as well. So those are significant, I think, policy decisions that need to be made, not only from a national perspective, from a regional perspective as well. And so I would say after this, we need to sit down as the region and say, all right, how can we now better prepare for something that will eventually come down again, because it's going to come again.
Okay, that's a very sobering thought to close off with as we try to get through this one. But I think the reassuring point is that we actually have more control than we think. If we keep our distance, if we wash our hands religiously, not touch our faces, that's the hard part for me. I am guilty if you catch me on camera. But just recognizing that for this period of time, we have our part to play, and it requires a lot of actions and commitment to follow through on those actions at home and for yourself.
Absolutely.
Thank you for coming in, Dr. Figueroa.
Thank you for having me.
All right, we're going to go ahead and take a break, and we'll be back in a few.